Welcome everyone. My name is Dr. Vanessa Salcedo and we are excited to introduce our Grand Rounds educational series. And today, for our first Grand Rounds, we have the director of our Speech and Language and Voice Laboratory, Ernesto De Genova.
Thank you very much, Dr. Salcedo, and welcome to this brand new conference room that we have here at Union Community Health Center. Okay, so we are going to start saying that I designed this three-dimensional explanation, graphic explanation of what speech-language pathology is. On the blue balloon here we have speech, and on the yellow we have language and pathology, and we have all intersections over there. So that means that speech and language, they go together, but we consider them as individual entities in order to understand what pathology is related to speech and then to language. This graphic shows also how big speech pathology is and all the related services that we have. And who is a speech and language pathologist? We own a master's or doctoral degree in human communications, its development and its disorders across the lifespan. We complete a postgraduate supervised clinical work also that lasts at least 9 months with a speech language pathologist certified, ASHA certified, American Speech and Hearing Association certified. And then we have to pass a national examination that is called PRAXIS. The role of the speech-language pathologist. SLPs assess, diagnose, treat, and help prevent speech, language, voice, swallowing, and other communication-related disorders. These are all the dimensions where we intervene the patients. SLPs work directly or virtually with the client and provide support to them and their families. We support individually to patients, and then we provide also family training. So we talk not only to the families or the caregivers, but we talk to other professionals, such as teachers, special educators, nurses, doctors, neurologists, orthodontists, audiologists, physical and occupational therapists, social workers, psychologists, and dietitians. So speech pathology is related to almost all the other specialties in order to address speech and language pathology. We help people to find other ways to communicate. That's called the augmentative and alternative communication, or AAC. When a patient cannot speak, we use electronic devices where the patient can find they press certain buttons and they can express what they need. And families get trained also to understand and to comprehend the new communication way that these patients learn. And then we do research to find new and better ways to treat patients with communication and swallowing disorders. And this is related to all the fancy machines that we have in our laboratory, because we use these softwares and electronics devices in order to measure and quantify what patients do, and that way we justify the need of the services to the insurances. Speech and language diagnosis process. It's a complex process. We assess and we describe and interpret the way that an individual communicates, and requires the integration of a variety of information gathered in the evaluation process. Producing speech includes the coordination of many things, including thinking, remembering, and organizing your thoughts, listening and understanding what you hear, retrieving words, arranging words in the proper syntactic order, coordinating respiration and phonation to speak with adequate volume and vocal quality, using prosody and tone to convey emotion, and coordinating the speech mechanism to articulate desired sounds. Each of one of these items corresponds to specific pathologies. An example, producing speech includes the coordination of many things. So when we have a patient that is suffering aphasia, an example, they lost the ability to organize their thoughts, to think and to remember words, to understand and to retrieve the words. So that's why I organized this slide in this way, because I just wanted to explain that each of one of these items are related to a pathology. What is a communication disorder? A communication disorder is an impairment in the ability to receive, send, or process, or comprehend concepts of verbal, non-verbal, and graphic symbols systems. The communication disorder may be evident in the process of hearing, language, or speech, and we have 40 million Americans that have communication disorders. This disorder affects how you deliver words, sounds, and how you communicate with others. It's important, very important, to say that 1 in 10 African American children ages 3 to 17, they have a voice, speech, language, or swallowing disorder. And compared to white children, 7.8% and 6.9% for Hispanic children. So this shows the disparity in ethnicities and how speech and language pathology intervene with these populations. What are the 4 most common types of communication disorders in the clinical setting? Speech sound production, we have language, voice, fluency, and swallowing. And it's important to understand the system-dimensional relationship between the anatomical, psychological, functional, and psychological. Sorry, I made a mistake here. It's a different item over there. So the anatomical is the structures. We are talking about everything that is concrete. That is, it could be bones, muscles, cartilages, tendons, and then the we have the oral motor part. So that means that breathing, blowing, chewing, and swallowing functions, coordination, they have to be related in order to produce the speech, for the speech to happen. And then we have the functional dimension, the ongoing speech in context. That means when the people or the patients are communicating in a specific setting, that it could be the phone or face-to-face with the person. And then the psychological, that is one of the most important of all, because we have the pragmatics and how the person uses language in order to relate to others, and how using language to get information from others also. And the problems that we have with the psychological aspect is that in schools there's a bullying, lack of social acceptance when a child has a speech problem. So we need to see all these dimensions related in order to start understanding what's going on at the level of speech and language in a patient. What causes speech, language, and swallowing problems in adults? So we have stroke, head injury, Parkinson's, Alzheimer's. We have right and left hemisphere brain injury, breathing problems, dementia, head and neck cancer, vocal abuse, and severe long-term illnesses. What type of communication disorders do SLPs treat? First of all, we have in our practice the most aphasia patients, all those patients that they cannot speak, understand, or read or write, or using numbers due to stroke or brain injury, that they had sometimes all these characteristics of the language affected. Apraxia of speech means problems controlling mouth muscles to speak clearly, so the patient knows what they want to say, but the muscles and all the circuits, peripheral circuits, are not responding. Then cognitive communication disorders, problems with memory, reasoning, solving, and attention. Dysarthria, weakness or tightness in speech muscles that cause slurred or very quiet speech that may be heard or to understand. So these patients, we say to the patient, open the mouth, the patient is going to show their hand. If we say, close your mouth, the patient is going to protrude the lips. So the processing and then the order, the brain order, in order to put all the muscles and everything together in order to produce the speech are affected. And the last is voice disorders, changes in how a person's voice sounds. It could be high or low pitch, too soft or too loud, hardness, unable to make a sound, or aphonia. Swallowing difficulties. The consequences of swallowing or chewing are dehydration, malnutrition, food or liquid going into the airway, called aspiration, provoking pneumonia. And then we have frequent pneumonia or respiratory infections. Less enjoyment of eating. Patients, they don't, because they are afraid of get aspirated, so they don't enjoy when they are eating, or sometimes they have taste issues, and they cannot relate what is sour or what is sweet or salty. And then the embarrassment, because sometimes they don't have the oral motor skills to eat and the food is coming out from the mouth. And the need for tube feeding or other ways to get nutrition. Now I'm going to talk about malocclusion. That is one of the other entities that we see in our practice, and how malocclusion affects speech. We want to know if a malaligned teeth cause speech problems. What are the effects of malocclusion? How open bite can affect speech clarity? So for all these questions, I would say that if you see a child or an adult, the problem always is swallowing, because this pattern of misaligned teeth is because the tongue is pushing forward, and we need to address that with speech therapy. And open bites can be seen in children as early as 4 years old. When an open bite is first seen with the baby teeth, parents often ask, how early can I close my child's open bite? So they ask the orthodontist, they ask us how we are related and we are talking to each other, and we want to know case by case. So we don't have the answer. We have to see the patient first and see how functional is the patient in order we observe swallowing, chewing, and breathing, and the ability to blow in order to see how all those functions, core functions, are affected because of the malocclusion. Malocclusion and speech pathology intervention. Malocclusion happens when teeth meet improperly, or they don't meet at all. While each individual bite problem is unique, there are 7 broad types of bite problems that are common in children and adults. And they not only affect chewing or swallowing, but the sound production. On the first picture, you see that the upper teeth are behind the lower. On the second, there's an open bite on the center, so the center teeth, they don't meet the middle line. And in the last one, we have the upper teeth, they are not meeting at all either. So one other reason why we see patients in our office is mouth breathers. If the top jaw grows down, the eyes look prominent and the outer corner of the eyelids will sag, making them look tired with too much white of eye showing, and then the lower eyelid will develop a ridge rather than slope smoothly into the cheek. So this is a great case that I have maybe 2 or 3 during these years, because the body position, the alignment is wrong. And if you see in the picture, there's a narrow face and the bad posture in the back. So this kind of patients is, they are excellent to work with physical and occupational therapy, not only speech, because they have to go to physical therapy first to fix the alignment, and then we can work with them, because alignment is related to the insertion of the muscles that manage the swallowing, chewing, breathing, and everything. So we have to improve that first, and then we are going to treat the patient. These are mouth breathers. Another cause is the children that they suck their thumb, so they deform also their hard palate and their teeth, the occlusion. So these are cases that we can treat and see. What is tongue thrust? Also called reverse or immature swallow, is the common name given to orofacial muscular imbalance, a human behavioral pattern in which the tongue protrudes through the anterior incisors during swallowing, and the speech is affected. If you see on the first draw, here is the correct physiological rest position, and the patient breathes using the nose. But on the second one, the nose is closed and the circuit is closed. So even the problem in here is that all these muscles, bones, face bones, malar bones, they are not going to grow up because these bones are related to the nose and are connected. And if the air is not passing through the nose, these bones are not going to get the flow of the air in order to grow up. So you are going to see this kind of face from the last slideshow, that is with the eyes going down and the mouth is open and in a resting position, and then the posture is the jaw excursion and the head. We have oral placement therapy to fix all these problems, and we have different OTT materials and tools and techniques to help the patients to improve their breathing, chewing, swallowing problems. The voice laboratory. Voice laboratory, it's we use different fancy machines here, and we use the sonometer, we have the computer with the speakers, the piano, and a microphone, all connected to the software that we are going to use in order to analyze speech. All this software and hardware related helps us to understand what's going on with the patient. We have the connection between the hardware, all these electronic devices, and the software that is called PRAT. It's a very specific software that allows us to analyze the not only voice but speech and the speech production. An example, if I have a patient with dysarthria and the muscles are not working and the patient his speech is very slurred, so I'm going just to take a sample at the beginning of the session and measure what is the frequency in hertz, what is the volume of that voice, and how long that the patient can last in a sustained vocalization. So those are the three measures that we use in order to know what's going on to the patient, to diagnose, and then to make the plan of treatment. A voice disorder occurs when a voice quality, pitch, and loudness differ or are inappropriate for an individual's age, gender, cultural background, or geographic location. And if you see on the first picture on the top, there are normal vocal cords, and the color is different from the picture down or below, that is with vocal nodules. And when a voice disorder happens, is present when an individual expresses concern about having an abnormal voice that does not meet daily needs. It could be a person who works professionally with voice, it could be a person who just uses the voice on the phone, or it could be a priest, or someone who sings songs in the church. All those cases we have here, and we treat them with this kind of therapies. And here I have some samples of voice disorders that I would like you to hear. The first is, this is muscle tension dysphonia. This is a functional dysphonia. So there are no damage at the level of the structure, but the function is affected. So the breathing pattern, the voice production pattern, the resonance and the projection of the voice are all affected. As you heard, it's very effective, and the patient was depressed because she couldn't talk to her family on the phone. So after the therapy, and she couldn't go to appointments or just to relate with other people because she felt that her voice was wrong, and she didn't want to be asked what's going on with your voice, what's happening to you. So that's why this patient was very motivated to come for therapy in order to fix this problem. And here is the result. I had a problem with the cable, and the recording is not a good recording, but it's the only one that I had for that day, and it's this one.
Cuando yo tenía 6 años, vi en un libro sobre la célula que se titulaba Historias vividas. Una magnífica lámina representaba una serpiente boa que se tragaba a una fiera. En el libro se afirmaba que la serpiente boa se traga su presa entera sin masticarla.
So this was only 8 sessions. So this person was incredibly capable of implement all the exercises that I suggest to implement at home. So she did, besides our sessions, twice a week for half an hour, these patients practiced 3 times a day, morning, afternoon, and evening, implementing all the exercises. So when the patient is interested and motivated, I think we can go beyond all the things, and it's very motivating for us also. And this is one of other example of this is Shirley, and she's a Parkinson's patient, and let's listen what she has to say.
Around a lot of times.
Anything else?
Horse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then that can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. So I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My eyes and my nose, and I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "Well, I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell do you?" My daughter said, "Oh, Mom, that's you?"
Isn't that good? Don't you feel wonderful?
Oh yeah, because now she can't say, "I didn't understand what you said."
Right. No excuses, right?
Yeah, no excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
And that's an important fact, because Parkinson's disease patients they think that they don't, they yell, and they don't. So it's their own perception of the voice. So we teach them to rethink about it and think loudly. So that's LSVT, loud, that is for voice, and global is for physical and occupational therapy. So it's a great program that we are certified in order to provide this to the patients. And I didn't get results as this because she's excellent, but we have some Parkinson's disease patients that they came for not only voice, but for language and speech. So we address the whole system, 3 areas. And this is at the Voice Laboratory, we address gender affirming voice therapy for transgender population. And this is a clinical case that we had the opportunity to present at the GLAMA National International Association in St. Louis, and this was a great case. And the patient learned, and as a therapist, I learned also. And we took 12 months in order to help this patient. This is the recording from the evaluation.
Solo que tomar la decisión de la corte que va a tomar un tiempo, por ejemplo, 3 meses, a que ya se cambie.
She was in the process of changing her name, and what she says in the recording is that she went to the court, and the court denied because she didn't have the vaginoplasty and the breast augmentation, so she didn't have her reassignment. So that was the reason why they didn't do it. But after she got those surgeries, she got her name changed, and she was a new person. I'm very happy. And this is the recording after 12 months of voice therapy.
Part 1, Provision of Care, Treatment, and Services. Create our clean environment that is inclusive of LGBT patients. Avoid assumptions about sexual orientation and gender identity.
So this not was only the case of the person who needed the voice to be addressed in order to affirm her gender, but she needed, the picture shows, makeup, she needed hairstyle and electrolysis, and
Here are some pictures that match.
And how to walk on high heels. So we found for her different services besides speech. So we not only address speech, language, or voice problems here, we go beyond that, trying to identify what other problems or issues the person could have, and we can help with that. So it's just to look where we can find places where this patient can go in order to address. In this case, it was a person who she was wearing red lips, and when she went to these classes, after that she was very simple and pretty, and she was great. So before that she was exaggerating everything, and after all these classes she could just to simplify everything. So it was a great experience for us. And then I have this case that is Rachel. So this is the before and after. This is Kathy Perez. She's a speech pathologist, and she works since 2004. I think she started with therapy addressing this kind of problems.
The movie was really good. From my point of view, I mean, not following the other movies so much, I liked it, seeing where Wolverine came from.
And this is after treatment.
Well, I just saw that new X-Men Wolverine movie. It was a really good movie. I liked it. There's a lot of hot guys in there, so anybody who wants to see it, definitely check it out.
As you saw, the first thing she did was laughing. So we addressed laughing, coughing, and sneezing. Because my patient, she was in a place and she needed to cough, and she was in a high pitch, and when she coughed, it was a main coughing. So she said, we need to address, and I said, yes, that's something that we have to do. So we learn together how to do that. And will speech language pathology services help people? Well, yes. 84% of people with speech disorders or dyslexia or apraxia make progress in the hospital or outpatient settings. 81% of people with language problems after a stroke make improvements with outpatient services. And over half of people in the hospital no longer need a feeding tube after receiving swallowing treatments from an SLP. Who pays for speech language pathology services? Medicaid, Medicare, and private insurance companies pay for speech services. Coverage will vary, and not everything is covered. And patients need to check with their health insurance or company in order to find out what is covered and what is not. And we receive referrals to this fax number, that is 718-618-8421, or Athena, using Athena for refer patients. And thank you very much. This is the Speech and Language Department and Voice Laboratory. Thank you for your attendance.
Thank you, Ernesto. This was an absolutely wonderful presentation, and I learned so much. As a pediatrician, I never even thought about when I saw a patient with an overbite to thinking how it affects their speech. And these are the things that are important to think about. Are patients with Parkinson's disease, are they going to speech therapy? Are patients that have aphasia from strokes? You know, as providers, we have that ability to recognize these pathologies and refer them to our wonderful practitioners here and his team, and especially the gender-affirming voice therapy. That's something that a lot of practices don't have, and we have that opportunity to provide that for our patients. So I'm very excited to learn all these things. We hope to get referrals into the department to really make an impact in our patients in the community. And I want to open it up for questions. We have several providers here in the room, and I know several are online. You can go in the chat box and do a question if anybody has any questions. Yes?
Can you teach a woman how to hail a cat so that it stops for her?
Yes, I can.
Like a mere voice.
I teach how to yell safely. Yes. Taxi!
Any other questions?
Very good.
Yes, Dr. Ron?
Can you teach us how to sing well?
Yes.
That's what I was thinking. Anybody, any new singers here? You do have singers that you
Yes. We treat singers also. Yes.
So there's still hope for us.
There are no singing classes, but it's treatment.
Dr. Wingfield, you have a question?
Boy, you're on top of the unmuting. Yes, I just wanted to say for the malocclusion, I always find this to be very interesting. Maybe we can consider during maybe pediatrics potential with speech a little campaign against like late use of pacifiers and bottles.
Yes.
For me, that's our biggest risk for the malocclusion in our patients. So that 2-year-old, 3-year-old that still has their pacifier in their bottle, you can clearly see the malocclusion. So it would be like a kind of preventive type of campaign. Because I never really noticed, the impact it has on the speech, but I always see the malocclusion.
Yes, primary prevention is the most important because we want to teach parents that they have to put the limits and not allow the children to suck their thumb. Or we have behavioral health services here, so we can address that with parents and children in order to change that. So they are not, it is the group, so it's not only pediatrician or speech, it's behavioral health and psychology also.
Yes, that's great. And also having a therapy session with Ernesto, if you find any patients with malocclusion, that might also prevent further of the habit, because a lot of the parents aren't aware how it's going to affect the speech, and then those are things that might motivate families for the corrective behavior.
Yes, that's correct. And as I said, the family training is the most important, because parents they don't know, and we have to educate them. So if you have more questions.
Oh, Dr. On?
I think also for young children or people doing poorly in school, a lot of times they don't, they're afraid to verbalize or ask questions, and it's related to their voice too.
Yes, it could be when they cannot express. It could be psychological, functional, anatomical. We have to find out. But sometimes, if they cannot speak clearly at school, maybe it's an apraxia. So we see a lot of apraxia, and that's an entity that Rosa Manotti will present in the next set of rounds. That will be speech pathology in the school setting and in the clinical setting also, but it will be children. Yes. But we have, well, Rosa is the specialist, and she treats excellently. She's beyond, so I think connecting the school system with us in order to treat these patients is incredible, because the problem is that sometimes they have therapy at school and they want more therapy over here. So we offer that too, so we can provide some services extra to the patients when they are already receiving at school, because at school they don't work the oral motor part. So that means all the exercises, the gymnastics for all the organs, so it will be lips, tongue, jaw, so they don't do that. So we have to do that here at the clinical setting.
Ernesto, I have a question. Why would treat? I know there's a lot of different, reasons why a provider should refer, especially a child, right, for an evaluation. But can everybody be, evaluated, at a certain age, just to make sure that there are no, that there's no issues, or to kind of to prevent it. I'm just trying to think to see how can we kind of have everybody involved, because currently right now, I think providers are, referring mostly when they see the problem, there's already a problem most of the time, and then, by that time, then we have to engage them in other therapy. But if there's something out there that you could recommend,
Yes. So for children, when they are 2 years old and they are not putting 2 or 3 words together, it's a bad indication, and they will need to address that. If they are not expressing wants and needs at 2.5, there's a problem. So we have to see the cultural and the genetics backgrounds, because we have different genetics, and sometimes the genetics are affected, and that affection reflects in speech, in swallowing, or information processing. So we need to find out what's going on with these patients. And then for adults, for the aging, so when they have trouble swallowing because they are taking pills and it is too big, and they said, okay, this is too big, is there another alternative? But it's not the pill that is big, it's the function that it is aging, and we have to address that.
Parents cut them in little pieces and kind of...
Yes, that's an option, but if there's problem swallowing, we have to address that. So the prevention will be that it's not the size of the pill, it's the function, the swallowing function affected, and most of the elders, they don't know that. They think that it's too big, and it's not the big thing, it's just the function that was deteriorated. So we do that, and I think I presented once here at Union. It was a great presentation about prevention of dysphagia. Dysphagia is the inability of swallowing, or the difficulties to swallow or to chew it. So we have for that different ways to address only the oral phase, because for the pharyngeal phase or the other phases that are related to the larynx and the pharynx, so that they are inner parts of the throat, we don't address that. We only work with adults that they have problems with chewing. if they, an example, if they are drooling or if the food is coming out of the mouth when they are eating, so we can help with that. But the other part, we have to look for other place where, yes, we can do that. Yes.
And Dr. York?
Dr. Salcedo, just before we close, would you just mention the importance of this program as it relates to the early intervention program that's coming online soon?
Yes, so a sneak peek. So we're very excited that Union Community Health Center will be launching an early intervention program. We're in the process of finishing all the site approval, but this is very important because unfortunately, as the pediatricians know, that the services get denied with the insurances. But early intervention is another program that these services can be expanded to our patients. And there's long wait lists for our patients to get into these programs. There's not enough programs and there's not enough bilingual providers. And fortunately, all our providers here are bilingual. So our patients will benefit from this, especially, of course, Spanish-speaking community that we have here. So, and not only will it include speech, but it will also include physical and occupational therapy, which we will talk next month. And a couple of things, last thing that I wanted to ask Ernesto is that I know as a specialist, you always think about, those patients that are out there that you would love to see more, that you know that you can do more and we can provide more services for. Can you list a couple of those patients that you know that some of the providers out there can refer to you and improve their overall voice and speech and health?
Oh yes, of course. The type of patients that we want to see more are all those patients that they are coming out from the nursing facilities where they were intubated. So after that, as an outpatient, we can address and we can evaluate and see how we can help. Because when they coming out from the hospital, from an inpatient to an outpatient, they don't have the tubes, or sometimes they have. It would be Pasimur maybe, but if the patient don't have the tubes, we can work with these patients. And then the other patients that we want to see is aphasia patients. All those patients that they have stroke, we can help them. We're ready to help them, and we can do it. We've been doing it since 2012. So it's very important to know that we can, and we have great experiences with these patients because they recover the ability to communicate. So they come to us without producing sound or following the directions and lost. So the cognitive therapy, language therapy, speech, voice, swallowing, we can address all those problems for the stroke patients. And then for Parkinson's, dementia, and all the degenerative neurological disorders, we can work with those also. So it will be sometimes not a prevention, but it will be maintenance therapy. So what we want to see on those patients is not to lose the ability to breathe, to swallow, to blow, and to chew. Yes.
Perfect, thank you. And I just want to thank everybody for coming. I want to thank you, Dr. York, for this opportunity to put together these grand rounds at Union. And also, we will continue these on a monthly basis, the fourth Wednesday of every month. For those at 188 or that want to come to 188, lunch will be provided. So we really thank the support from the executive team for this learning opportunity. And I want to thank everyone for coming, and we'll see you next month.
Thank you.
Thank you very much, everyone, for coming. And if you need to refer patients to the speech department or the voice laboratory, please send them to the fax number 718-618-8421. Thank you.